Well, our other big story tonight, city fire rescue ambulances increasingly in short supply as COVID-19 sends more patients to the ER. The chilling call is critical mass index 0.
Yeah, that's a signal to emergency medical services personnel that there will not be a city ambulance available if one is needed. Fox 10 News investigative reporter Brendan Kirby now joining us live. And Brendan, today's not the first time that call has gone out.
Yeah, that's right, Byron and Shelby. Several times during this most recent COVID surge, every single ambulance in the city has been tied up. Prior to the pandemic, that was unprecedented.
Station, stand by to copy general information. Fire alarm has reached critical mass index 0. There are no rescue trucks citywide.
This alert went out at 11:21 a.m. Mobile fire rescue workers were on notice. There were no ambulances available to respond to an emergency. The reason? COVID-19 had the fleet tied up.
That means that that next car wreck, that next cardiac arrest, that next diabetic emergency, stroke call, any of those medical emergencies where we would normally respond and have a very quick response time may be delayed because we don't have any ambulances available.
That was fire rescue spokesman Stephen Millhouse, who says paramedics respond in fire trucks when no ambulances are available. Fortunately for a driver who crashed into a house on South Washington Avenue today, an ambulance had just come back online from the hospital. Millhouse says there have been times when a natural disaster has put all of the specially heavy rescue units in service at the same time. But before the pandemic, officials don't recall all of the ambulances being deployed simultaneously. Mobile Public Safety Director Lawrence Batiste says capacity consistently has been tight between 3 and 7 p.m. for the past week and a half.
We're doing everything we can to try to expedite that process, and the hospitals are doing everything that they can as well to try to expedite that process, creating additional space to make sure that they can intake people a lot sooner to get ambulances back in service as quick as possible.
Randy Murphy, the top epidemiologist with the Mobile County Health Department, says she fears more people with emergencies will drive themselves to the hospital.
It could really mean that people have bad outcomes. So it will be very sad when, a mother goes into labor or someone has a heart attack or a motor vehicle accident injured, a person or a child that needs transport to the hospital, and not having an ambulance available to that.
Mobile Chief of Staff James Barber tells me the city recently added a 12th ambulance and has 2 more on order. But those orders take time to fill, especially with COVID wreaking havoc on supply lines. Reporting live, Brendan Kirby, Fox 10 News.